Polycystic ovarian syndrome, PCOS. 3 simple letters, but a condition that affects more than 1 in 10 women worldwide. For many, it remains a mystery, undiagnosed, misunderstood, and often dismissed. Behind every statistic is a woman's story, a story of questions without answers, of doctor's visit, of irregular cycles, of acne, of hair loss, of weight struggles, of infertility, and of resilience. Today, we explore the journey of PCOS, the signs, the struggles, the myth, and the hope. PCOS, or polycystic ovarian syndrome, is a hormonal disorder that affects women during their reproductive years. But what does it really mean? Let's break it down.
This is what we call polycystic ovarian syndrome, now often called polycystic ovarian disease, that is PCOD. As against PCOS, which we all know is polycystic ovarian syndrome. It is a condition that is caused by hormonal imbalance in women of reproductive age. Now, it most often leads to irregular menstruation, or sometimes amenorrhea, that is lack of menses. Woman may not see menses. This is woman in reproductive age, so you will now start wondering, why should this woman not be seeing her menses? What we call anovulatory amenorrhea, meaning this woman is not ovulating, so she's not menstruating. So what could be the cause of what is actually this polycystic ovarian syndrome we're talking about? In polycystic ovarian syndrome, we have a situation whereby there are multiple tiny sacs of fluid that are seen developing around the edge of the ovaries. The ovaries are in the woman that is like a reproductive organ in the woman that produces the egg that is later being fertilized by the sperm for pregnancy to occur or conception. So in polycystic ovarian syndrome, we have tiny sacs, small sacs of fluid like this around the edges of this ovary. And then these sacs, over time, they should be matured enough for one to actually release the egg that should be fertilized. But because of how they are polycystic, these sacs contains immature eggs, and the immature eggs that are in these sacs that we call follicle will not release this egg, fail to release this egg, and so that's why she will now not be ovulating, because the release of the egg is what we call ovulation when the egg is released. So PCOS causes anovulation, that is, makes ovulation not to occur, as the woman tends not to ovulate. And I know the next question will be, what's the exact cause of this PCOS? And so I will say that the cause is actually unknown. We've actually not known the cause of this, but there are some postulation that have been said to actually be the cause of this PCOS. And then we have the hereditary, we have the fact that there will be excess androgen, and then there will be inflammatory effects as well. So these are some of the postulations that have been noted to actually be associated with this polycystic ovarian syndrome. It's actually a very complicated gynecological condition because it's actually metabolic.
Symptoms vary, but often include irregular periods, acne, unwanted hair growth, weight gain, hair thinning, and sometimes infertility. But PCOS is not just a reproductive issue. It also increases the risks of diabetes, high blood pressure, and depression. Numbers and signs tell one part of the story, but to truly understand PCOS, we must listen to women who live with it every day.
So my period has never been regular ever since I first got it when I was 12. In year 11 it was on every week and then off for a week and then on for a week and off for a week. It feels like you're so out of control of your body, and it's not just the bleeding, it affects every aspect of your life. It took a long time for me to be persistent going back to the doctors. Finally got to have a scan, which is when I got my diagnosis for PCOS. I think people don't realise that PCOS is a problem. They just think, oh, it's just a period, it's just an irregular period, and don't quite realise the impact that that could have on the rest of your life. So with PCOS you could go from anything from having 6 weeks no bleeding at all to 6 weeks of constant bleeding, which in my experience has also led to being anemic. Having had my diagnosis, I've tried to do as much research as I can and take it into my own hands. I've found all sorts of fad information about weight loss and dieting, and I think as a 16-year-old I was quite vulnerable to those messages online. It's important to find information that you can trust. It's not just a period, it's a problem. I don't think we talk about menstrual health enough in the workplace, in education, in schools. I would advise any other women to push for a diagnosis. If you feel there's a problem, you know your body best, push, go back until you get a diagnosis.
For some, the impact is not just physical but emotional. PCOS can cause anxiety, depression, and feelings of isolation. The quick question to always ask is, why does PCOS happen? The truth is, science doesn't have all the answers yet. But here's what we know.
Hormonal imbalance. What we are about hormonal imbalance is actually exaggerated, a high level of androgen that is being produced by these ovaries. And this androgen, when they are too much, they interfere with ovulation. And with that, these eggs, the egg will not be released. So when the eggs are not released, ovulation does not occur. That's the hormonal aspects trying to talk, because initially there will be insulin resistance associated with it, and that's why it usually leads to type 2 diabetes and all that along the way, because insulin resistance leads to deposition of fats and then production of this androgen that will now affect the ovaries and hamper ovulation, which in the long run will now give rise to the androgen effect. Is what these women will now come down with those features that we see appear, like the manly tone, the masculine hair distribution that these women will have, like acne, how this male pattern of hair distribution on their face, and then even their voice actually appear manly or masculine, if I should use that word. And no, it's actually as a result of this, the insulin resistance or the hormonal imbalance first. Once the hormonal imbalance first, there's elevated androgen in species. What are androgens? Androgens are like male sex hormones. The female have their own, the male have their own. And then androgens are like male hormones. And then these male hormones, over time, they tend to, if there are more in a woman, they tend to reduce the female hormones, as the estrogen and the progesterone, and so now tend to masculinize the woman. So those changes that could have occurred from the female hormones, like the estrogen, will not be there. That's why the ovulation does not take place. And ovulation, like you all know, is when the egg is being released for fertilization, possible fertilization to occur. And if that is not done, the estrogen level reduces. And then the estrogen also helps in this, the menses of this, the endometrial lining. And that's when that is also reduced, the woman will not menstruate. One, she's having irregular menses or not having at all. Two, she is obese. Three, she has male pattern of hair distribution. Those are the three common features. And then the other ones are sonographic findings, radiologic findings. That's when you do a scan, ultrasonographic features, where we now find these multiple sacs of fluid around the ovary. Those are what now help in actually diagnosing PCOS. Let's start with the basics now. There's abnormal, there's insulin resistance. So the body does not respond to insulin. And this will now lead to increase the blood sugar level. And then with time, there's this abnormal cholesterol level. This cholesterol level over time may now cause obesity. Obesity will now lead to reduction of this androgen. These androgens are hormones. And then when these androgens are produced, it now causes these follicles in the ovaries not to actually mature for a particular egg to be released. When these eggs are released, the estrogen level is also increased, which is what should actually give rise to the shedding off of the endometrial lining, which results in menstruation. So with the reduced estrogen level, menstruation not occur. When in women of reproductive age, there's a certain estrogen level that they should have during their menstrual cycle. It fluctuates. There's a particular time it reduces, and there's a particular time in the cycle where it increases. It increases during the proliferative stage of the menstrual cycle. And then after that, it now drops because there's a follicular formation. So the imbalance between this hormonal imbalance, the imbalance there is this estrogen, when it's supposed to be high, is low. When it's supposed to be low, it's high. That's the variation that we're having in polycystic ovarian syndrome.
According to the World Health Organization, Between 6 and 13% of women of reproductive age worldwide live with PCOS. That means nearly 70 million women across the globe are currently battling the condition. Yet, shockingly, up to 7 in every 10 women remain undiagnosed, many silently struggling without answers. Recent studies confirm that the global prevalence of PCOS is around 9%, although the figure varies depending on medical criteria. In some regions, the number is even higher. Over the last 3 decades, cases have steadily increased, making PCOS not only a medical concern, but also a growing public health challenge. Here in Nigeria, research is still limited, but available data paint a concerning picture. A study in Kano found a prevalence rate of about 6% among women, while another hospital-based study in the south revealed that more than 12% of women undergoing pelvic ultrasound showed polycystic ovarian fetus. Experts warned that many more cases go undetected, as women often dismiss irregular periods or weight changes as normal. What this means is that countless women across the country may be living with PCOS without even knowing it, exposing themselves to higher risks of infertility, diabetes, and even heart disease. Beyond the statistics, the reality is clear. PCOS is not rare, and urgent awareness is needed to help women recognize the signs and seek medical care early.
Once the girl child starts seeing her menses, initially there are some, when she starts seeing her menses, there are some periods where she might miss the menses because those initial phases of menses tend not to be regular. But once it starts getting regular, meaning there's now hormonal balance, the hormones have been properly regulated, and so the menses will now start becoming frequent. And now at any point in time where she realizes that the menses no longer frequent or she's missing often, seeking medical advice. Because she might be pregnant. She might have probably had unprotected sexual intercourse that has resulted in her getting pregnant. 2, it might be hormonal imbalance, which this condition, polycystic ovarian syndrome, is a common cause of that. So those are that's the number one what should I call it, tax for every woman or every girl in a reproductive age to actually look out for, because every month a girl child that has started menstruating should actually be seeing her menses. If you don't see your menses after 2 consecutive months, you should be worried. It's either you are pregnant or you are having an hormonal imbalance that is affecting your menstrual cycle. And so it is now important for you to seek medical care or advice. And that's the most important in this polycystic ovarian syndrome, because the condition is multifaceted, because it has the hormonal aspect, it has the genetic aspect, and it has the metabolic aspect. In the sense that if it is not properly managed, results in conditions like type 2 diabetes, mellitus, heart diseases, often in the long run depression from this condition. So it is advised that girls should look out for their menstrual flow and quickly seek medical care when it appears to be abnormal. It's the way your body reacts, the way your body handles what it takes to build itself up and what it removes as waste. It takes nutrients to build up, that is the anabolic phase, and then it breaks down waste products to be excreted, that is the catabolic phase. So these two forms the metabolism, that is metabolic stuff I'm talking about. So it's basically just the way your body handles what it takes in and what it removes. And then for the hormonal, there are substances that control or regulate our body systems. There are some that regulate the reproductive system. There are some that regulate the digestive system. In this particular topic, we are talking about the ones that regulate the reproductive system, being the estrogen in particular.
Though PCOS has no cure, it can be managed, and management means hope. PCOS is also surrounded by myths and misconceptions.
Spirituality, again, does not play any role in the management of polycystic ovarian syndrome. It is purely a medical condition that will be managed by medical professionals, especially in this case, a specialist gynecologist. So, the role spirituality plays, like I will always say again, we usually say that doctors treat, but God heals. And so we treat and leave the healing for God. So, but when you want to bring spirituality first in the treatment, it's wrong, because it's purely a condition where can be managed, should only be managed in the hospital. Spirituality does not play. That's when you say spirituality, I presume you're talking about fasting and praying and all that. It doesn't play any role. There's no spiritual aspect to it. And then for your second question, where you talk about how the hormones can be regulated, yes. It's worthy of note that this PCOS cannot be cured, but can be managed. So that you get this straight, it cannot be cured, but it can be managed. Managed in the sense that peculiarities associated with the complaints associated with it can be managed. If the lady comes down with a complaint of having this male pattern of hair distribution, that can be managed on its own. If she comes down with irregular menses or absent, she's not seeing her menses, that can be managed. If she is not ovulating, she can be given drugs, medications for her to ovulate. You understand? If she's having metabolic issues, insulin resistance and all that, she can be given. But cure is something that cannot be achieved with polycystic ovarian syndrome when it has been established that this condition is polycystic ovarian syndrome. That's why if you notice the first statements about this was that the cause is unknown, but there have been postulations about it. So in managing it, we purely managed based on symptoms and signs that this patient presents with and what is actually affecting her quality of life at the time. So, and that's why it's important when I say that prompt medical care is actually, or counseling is actually important for these women. You don't have to stay for long before you present to the hospital for you to be evaluated and then managed as so there's no food that can be associated with it.
I was diagnosed with PCOS. But even before then, I already noticed that my periods were not consistent. They were very irregular. So I was seeing my periods like once every 4 months kind of thing. And at the time, it didn't really bother me. Like, I didn't really think about it because I had Googled it and they were like, you know what, it will just regulate itself back again. And this is coming from someone who always had consistent periods, someone who never skipped a month without seeing her period. But when I moved to Canada, I think 2017 was when everything started. We got tested, I got tested rather, and I was diagnosed with PCOS and multiple like polycysts, like multiple small cysts in my stomach, whatever. And you know what, at the time I wasn't really like worried. They put me on birth control pills at the time. I was using it very diligently, very consistently, but then I just got tired. Like, guys, I got tired of taking the pills, so I just stopped. And while I was on the pills, I wouldn't even lie, my period was consistent, like it was coming. But then I don't know if that was really fixing the situation or if it was just managing it, if you know what I mean. So I just decided that, you know what, I'll stop using the pills, which I did. So my period will come like once in 4 months. So when it comes, it will stay 10, 12, 13, 14, 15, 16 days at a stretch. And this is not just like regular period. This is heavy flow, heavy serious flow. I remember one time it got so bad that I had to go to the hospital, and then they gave me like a pill to use. So they gave me only like 4 or 5 of that pill because they said I can't consistently take the pill because it can affect me. So they told me that it's supposed to clot the blood, that within 2 days, so they gave me I think 4 days of the pill, that within 2 days it's supposed to stop. This period defied that pill. Like, the pill helped, or it was thinning out, but it didn't cease, it didn't stop. Infertility is a side effect of PCOS, right? Oh God, I thank you. Side effects of PCOS, but obviously my husband is like, yeah, it's okay, like we'll get through it. When we get to that bridge, we'll cross it, don't worry. We have faith in God. You know, just all these encouraging words. And to be honest, knowing that my partner was so supportive of me, the best. I remember I was sudden in May, because me too, I joined the girlies that were using the Eve app and tracking my flows and everything, because before it was pointless. When the period was doing anyhow it wants, like you can't even track, you cannot monitor it. So I downloaded the Flow app when I noticed my period had been coming consistently. Yeah, Flow, not Eve. Yeah, the Flow app when I noticed my period had been coming consistently. And then I just noticed that it didn't come in May. It said it was supposed to come on this particular day. I was like, okay, plus or minus 2 days. I waited, my period did not come. So maybe 2, 3, 4 days after I noticed that my period did not come, I was like, you know what, maybe I'm pregnant, right? So I took a pregnancy test. Lo and behold, I took the first one and it came back inconclusive. So no line 1, no line 2, it was blank. And I was like, did I make a mistake? What happened? Like, it didn't work. So I said, you know what, I'm gonna try again the next day. Next day I got another pregnancy test. I will see if I can put videos. I took videos. I recorded the entire journey. I took another pregnancy test and that one came back negative. So at that point I was like, yeah, you're not pregnant. And I feel like that negative that I saw almost reaffirmed that those negative thoughts of PCOS coming back. Okay, let's take the test. So I took the test, bought the one that had 2 in a pack, so one analog one and one digital one. And that was basically how we found out that we were having a baby. Oh, we're having a baby.
There is no cure for polycystic ovarian syndrome that we know of, but if the obesity is a risk factor, is the cause, then yes, losing weight can actually regress it back to normal. So there's that. But other than that, not really a cure for polycystic ovarian syndrome. What we actually do is we take care of the symptoms pretty much. If the increased male the hormone is the issue, then you treat that with medication. If period being irregular is the issue, then we treat that with medication. Or the other thing is, if you lifestyle changes and eating healthy, exercise, those can actually help to cure, I would say, or make it better, improve the symptoms of polycystic ovarian syndrome. But there's no exact cure for polycystic ovarian syndrome.
Support groups, counseling, and education also play a vital role in helping women regain confidence and take control of their health. PCOS is not a death sentence. It is not the end of the road. It is a journey, one that millions of women are walking every day. By raising awareness, breaking silence, and offering support, we can all change lives. If you notice irregular periods, unexplained weight changes, acne, or excess hair growth, do not ignore the signs. Instead, talk to a doctor, because the earlier you know, the better you can manage it. Behind every statistics is a face, a name, a dream, and a future worth fighting for. This is not just about PCOS. This is about women. This is about hope. Thank you for listening. I am a medium, James.